Hi there, my name is Frances Thomson and I'm a Biomechanics Coach, I Move Freely Program Director. And I'm here with my friend today, Skelly, to talk to you about the subject of biomechanics. Now, studying the subject of biomechanics might seem quite daunting to some, and it can be a very complex subject. But what we're here today to talk to you about is there's a whole spectrum or different ways of looking at biomechanics, from the very complex to very simple. So what we're going to do is try and help you understand different ways of thinking about the science of biomechanics to best help you help your clients. So what is biomechanics? Well, in very simple terms, it's the body's mechanics. It's the way we move. When we're looking at a client, it's what we see when they walk into our gym, our facility, or we see them out for a run or doing a squat. But there are two types of biomechanics that we could then separate to understand them a little bit better. There's the extrinsic biomechanics, which is what you see in your client when they walk around or they do a squat. And predominantly what we're looking at there is the way they perform tasks and their technique. And so our skill really as movement practitioners is to correct technique. The challenge comes when that doesn't work. And that's when we really need to understand the intrinsic biomechanics. And that really is, by definition terms, the three subsystems, so the myofascial, the skeletal, and the neural system. Again, very simplistic way of looking at the inside of the body. But what we need to try and understand better is how these three subsystems interact through the integrated system to produce what we see on the outside. This is tricky because we have skin and hair and clothes, most of us do, over our subsystems. And so as a trainer, as a coach, the challenge we have is understanding and really developing a deeper understanding of the anatomy and movement intrinsically to allow us to gauge whether what we're seeing on the outside or the extrinsic biomechanical analysis of our client is technique or is poor intrinsic biomechanics setup. So what we're going to be talking about today is how we develop a better understanding of those intrinsic biomechanics. Because every client that comes to you for improved movement, weight loss, bigger muscles, they want to run faster, they just want to feel great, or maybe they want to get rid of those little aches and pains and niggles. And so having a deeper understanding of the way those three subsystems interact, how we can assess them, evaluate them, monitor them, and then apply techniques or interventions to improve their intrinsic function, then what we can see from the outside or the extrinsic biomechanics is when things are working or having an effect. And that's really what we're going to get into today, isn't it? So the biggest challenge of understanding intrinsic biomechanics and getting that deeper level of appreciation is it's hidden. It's all underneath our skin, as we said earlier. So what we really need is an evidence-based system to evaluate and assess whether the joints and the muscles and the nerves function to their fullest capacity, have ranges that are required for each individual client. Now, the number one challenge is, of course, everybody is completely different. But if we at least have a system of benchmarking and then monitoring the quality of their movement, we have somewhere to start and a direction to follow. Now, every physical movement system is going to be flawed in some way. If we're trying to fit all of our clients into a set of norms, we all know how challenging that may be. We know that our clients have different femur lengths, they're different ages, they've got a different injury history, the way they move, even their confidence in the way they move, the levels of discomfort, body fat versus muscle mass, all play into really diversifying every single client that walks through the door. So we really need a system and the ability to logically adapt that system and understand how is it going to fit for every client I see to be able to produce results. So with that in mind, the way we teach you how to evaluate your client's body allows you to explore the same test on different individuals to at least have a start point whenever a client comes in for a consultation. So what we're now going to do is I'm going to talk you through one common compensation or one adaptation around the pelvis that can result in both descending and ascending compensations through the integrated system that is our wonderful body. So now we're going to take you through one of these adaptations. So a little bit of anatomy here, and this is how simplistically we can look at it. If we think about the pelvis as the start point, purely because it's the centerpiece that the spine sits within, and then the legs move below that. So it's just a good place to start because we tend to sit on this area predominantly. So our sedentary lifestyles, sitting at desks, sitting in the car, sitting on the train, on the bus, at the cinema, in a variety of places, has started to create adaptations at the pelvis. But more often than not, we don't necessarily hurt in here. And so I just want to describe the way the body might compensate for that. So we understand in simple terms the pelvis will tilt forwards or anteriorly and then backwards anteriorly. And when we're walking, it will do that in alternating fashion from one side to the other. So let me explain a little bit further. So as you're walking, or your client's walking, the leg will step forwards. This side of the pelvis will rotate up and back. And then as the leg steps back, the pelvis will rotate forwards and down. And what happens on the other side is the same, but in the opposite. So effectively, we're getting a lengthening and shortening through the legs as we walk. And that movement will happen around this area here. So it's the sacroiliac joint, or thereabouts. A combination of moves, but predominantly from here. And then we have the muscles around the hips, so the piriformis and the glutes, which we know are common to adapt to the sitting lifestyle. So the brain recognises it's a great compensator to reserve energy, and so the muscles will adapt in their ability to function or perform because we're not using them, so the body is trying to reserve energy. This can have several effects on the way we move, and if that adaptation occurs when the pelvis is in a certain position, it can actually create the appearance of a functional leg length discrepancy, which is really common, not normal, but very common. And the key differentiator is it's a functional leg length discrepancy. It's not different length femurs, for example. But what can result is, with the body's way of compensating, is the long leg will buckle the knee in to allow for the fact we have that kind of functionally long leg. So what our client might complain of could be knee pain, shin pain, or even foot pain. But the foot, the shin and the knee are not the root cause or the problem. And this is where our peers can often apparently fail, and yet they're doing their job. They're addressing the site of the problem or the pain, but the root cause is actually coming from higher up. Another compensation is that the close relationship with nerves like the sciatic nerve can mean that the muscles adapting can inhibit or tether the nervous system and give an appearance of a tight hamstring, where in fact the hamstring is actually trying to hang on and protect the nervous system because it's tethered up here. So if we're stretching clients and it's not working, then there's a good chance that the hamstrings are not tight. So consider how you're improving the function around the pelvis. If we go up the way, so in an ascending biomechanical fashion, that long leg adaptation may be apparent in an ilia sitting slightly higher, the ilium sitting higher on one side. We don't necessarily see this happen, but they adapt to a functional scoliosis because of the higher hip, so they might then complain of back pain. And we know full well that back pain is very common, but again, the back isn't the problem. It's where the pelvis is stuck, sticky, stiff, whatever you want to describe it as, or adapted, and it's creating this loading through the spine. It can also go as far up as the opposite shoulder. So if one side of the pelvis is adapted, it can influence the shoulder, and your client could actually complain of shoulder problems. And this might be when they come to you and they say they've had treatment, had things done, but it's a recurring issue. And that doesn't mean they've been failed by their our medical colleagues. It just means we haven't found the solution. And so the solution could be in another part of the body. And this is where we can collectively help each other out, use those therapists where it's appropriate, exercise the areas that are within our remit and not uncomfortable, and actually we can start to really think of their bodies as an entire integrated system, improve function, movement, and actually reduce low grades, aches, and recurring injuries. So wouldn't it be great as movement professionals, as personal trainers and exercise professionals, if we had a system to be able to fully assess our clients' pelvis, spine, shoulder, knee and foot function, to have a good start point and a set of benchmarks that will guide us through interventions that help us improve their movement quality. This of course brings us a little bit closer to our peers, the clinical world, the medical world and the therapists, and it will enable us with that deeper level of understanding of the anatomy, more improved vocabulary skills and understanding of the anatomy to be able to communicate better, fill ourselves with confidence and them with confidence in us and what we can contribute. Because it's my belief there is a huge population around there in the nation that we can help with movement. It's just having the confidence to do so without overstepping our remit. So would you like to know more? Okay, so you can head on over to www.biomechanics.education.com or you can find me, Rachel, at biomechanics.education.com, right? So what I'd like to go,